will be live streaming on our APH Facebook page and our APH Instagram page. We will have also our interpreter, who is an epidemiologist, who will be also repeating what our health authority has to say. And we also have our ASL here for those who need ASL. With that, I will introduce our mayor, Watson.
Well, good afternoon, everybody. We really appreciate you being here. Today, I'd like to start by talking about some of the work that's already been done at the city in response to the outbreaks of measles that we've seen across the country last year and the outbreak we're now seeing in Texas. As we learned from the COVID-19 pandemic, it's essential to ensure that our entire community is informed and prepared for any threat of infectious disease. Standing behind me are public health staff members and public servants who were vital to the response efforts during the pandemic. And their combined efforts with our community partners resulted in the Austin area experiencing the lowest total COVID-19 positive cases per capita. They're now here, they're ready, and they're going to respond once again. Our community's strength comes from collaboration. We've been in contact with our local healthcare systems, our child care partners, and public, private, and charter schools on the importance of vaccinations and how we can best support one another. Our epidemiologists are hard at work, monitoring trends at the state level and through local channels that we use for disease surveillance. We're also looking to bring up our local vaccination rate. Austin Public Health's nurses are administering the MMR vaccine through our Shots for Tots and Big Shots clinics, as well as our mobile clinics. By the way, you can join us on March 27th as we proclaim Vaccines for Children Day to celebrate 30 years of this life-saving program and recognize the importance of vaccines. Now, all of that is to say that the time that we have been preparing for is here. Our first case in Austin was confirmed moments ago. I have been in contact with Austin Travis County Health Authority Dr. Desmar Walks, who will give us more details in just a moment. I want to emphasize to everyone listening that vaccination remains the best defense against this highly contagious and deadly disease. It's time to check and make sure that you're up to date with your vaccination. Anti-vax information is just as contagious, so I want you to hear directly from our top medical experts. So I'm going to ask Dr. Walks to please come forward and talk to you about this case and about what we need to do.
Thank you. Good afternoon. My name is Dr. Desmar Walks, and I'm the Austin Travis County Health Authority and Austin Public Health's Medical Director. Austin Public Health today confirms the first reported case of measles in Travis County since 2019. It has been 25 years since any cases before that have been reported to us. This recent case involves an unvaccinated infant who was exposed to the virus during a vacation overseas. We quickly started our contact tracing investigations and found no exposures are expected to be connected to this case. The infant's family members were all vaccinated and are isolating at home. As of today, Texas has 148 cases of measles with over 18 people hospitalized due to complications this year. As many of you are aware, a person from the outbreak in West Texas recently traveled to San Antonio and San Marcos while they were contagious. A person is contagious 4 days before the rash appears and 4 days after the rash appears. It's still possible that people exposed to this person are in their incubation period, and we are closely monitoring for this. Early on, symptoms include cough, runny nose, red watery eyes, and a flat red rash that breaks out on the forehead typically and then spreads to the rest of the body. If one person has it, 90% of the people nearby who are not vaccinated may become infected if they are not protected with a vaccination. The measles virus can survive in the air and on surfaces for up to 2 hours after the infected person has left the area. People who have direct contact through coughs or sneezes should monitor for symptoms for 21 days after exposure. Measles is serious and can cause more than just a rash. Pneumonia and encephalitis, which is an infection of the brain or swelling of the brain, can be life-threatening complications that lead to death. Young children, pregnant women, and immunocompromised people and unvaccinated people are especially at risk. On Wednesday, the Department of State Health Services reported the first death due to measles in a school-aged child who was unvaccinated. One death is too many in 2025. The most important thing we can do today is make sure that we receive MMR protection. The vaccine is available at most doctors' offices and pharmacies. I'm also calling on our doctors to check with patients and remember to recommend vaccination if they haven't received measles vaccine. If your doctor doesn't have appointments available, ask that they give you an order or a prescription that you can take to a local pharmacy so that you can get vaccinated. And remember that children who are 14 years of age or younger need an order from a doctor in order to be vaccinated at a pharmacy. For children and adults who are uninsured, APH offers the vaccine at our Shots for Tots clinics, and our Big Shots clinics are available for our adults. As well, we have mobile vaccination teams that are available across the city. You can go to our website to look for our locations and availability. I will now pass this along to our epidemiologist, Flor Hernandez-Ayala, to provide this update in Spanish.
Thank you, Dr. Walks. Good afternoon. Buenas tardes. El Departamento de Salud Pública de Austin confirma el primer caso de sarampión reportado en el condado de Travis desde 2019. Han pasado 25 años desde que se registró cualquier caso antes de este. El caso actual incluye a un bebé no vacunado que estuvo expuesto al virus durante unas vacaciones en el extranjero. Al recibir este reporte, comenzamos rápidamente nuestras investigaciones de búsqueda de contactos y no se espera que haya exposiciones relacionadas en este caso. Todos los miembros de la familia del bebé están vacunados y aislados en casa. Hasta hoy, en el año 2025 en Texas, hay 124 casos de sarampión. 16 han sido hospitalizados debido a complicaciones de la enfermedad. Como muchos de ustedes saben, una persona que es parte del brote que está sucediendo en el oeste de Texas viajó recientemente a San Antonio y San Marcos mientras era contagiosa. Una persona es contagiosa 4 días antes de que aparezca el sarpullido y 4 días después. Aún existe la posibilidad que las personas expuestas a esta persona estén en el periodo de incubación y nosotros estamos monitoreando muy de cerca la situación. El sarampión es una enfermedad altamente contagiosa por vía respiratoria. Al principio, los síntomas incluyen tos, secreción nasal, ojos rojos y llorosos, y luego aparece un sarpullido rojo, plano, como unas manchas, que puede aparecer primero en la cabeza y luego baja hasta el cuello y el tronco. Si una persona tiene sarampión y hay personas no vacunadas alrededor de ella, hasta 9 de cada 10 personas cercanas se infectarán. El virus del sarampión puede sobrevivir en el aire durante 2 horas después de que la persona infectada haya abandonado el área. Las personas que tienen contacto directo con gotitas infecciosas o tocan las superficies que tienen estas gotitas pueden también estar expuestas y deben vigilar por síntomas por al menos 21 días después de esta exposición. El sarampión es un virus grave, pero prevenible mediante vacunación. Puede causar más que solo el sarpullido, sino también neumonía y encefalitis, una infección y la hinchazón del cerebro que pueden complicarse y ser mortales. Los niños pequeños, las mujeres embarazadas y las personas con el sistema inmunodeprimido o no vacunadas, especialmente no vacunadas, corren un riesgo especial. El miércoles, el Departamento de Salud del Estado de Texas informó la primera muerte por sarampión en un niño de edad escolar que no estaba vacunado. Una muerte por esta causa en el 2025 es demasiado. Lo más importante que todos pueden hacer hoy es revisar y asegurarse de haber recibido la vacuna MMR. La vacuna está disponible en la mayoría de los consultorios médicos y farmacias. También hago un llamado a nuestros médicos para que consulten los pacientes y les recomienden la vacunación si no la han recibido. La vacuna MMR. Si su médico no tiene citas disponibles, solicite una orden o una receta para llevarla a la farmacia local. Los niños menores de 14 años necesitan una receta de su médico para vacunarse en una farmacia. También ofrecemos la vacuna en las clínicas Shots for Tots y Big Shots, así como en nuestras clínicas móviles de vacunación. Los niños no importa que no tengan seguro médico o un seguro incompleto, y los adultos sin seguro médico también son bienvenidos. Existen recursos y están disponibles para obtener la protección que necesitan. Muchas gracias.
Thank you for that, and thank you, Dr. Walks. I'm now pleased to invite to the podium someone who cares deeply about this issue, and we're very fortunate represents us in the United States Congress, and that's Congressman Lloyd Doggett.
Thank you very much, Mayor, Dr. Walks, and the great team that you have here. We're here to say quite simply, measles can kill, ignorance can kill, and vaccine denial definitely kills. As evidenced by a first death in the Panhandle, by the spread here, San Antonio, and across the state, this is the largest measles outbreak in 30 years in our state. Health Secretary Kennedy's dismissive comments yesterday, claiming that it's not unusual, ignores this rapid spread and the danger that it poses. Next weekend, we will be welcoming to Austin thousands of people for South by, and spring break approaches. It is particularly important that these not become super spreader events of this most contagious virus, and that anyone who feels they have symptoms immediately notifies Austin Public Health. Dr. Walks and Public Health team we see here today are doing what they can to prepare for the worst as we hope for the best. But since the Texas state does little to support local public entities, Austin and other public health departments across the state, like Lubbock, for example, which has been at the forefront of this, depend upon federal dollars to get the job done. And that is support that is endangered by the chaos that's going on in Washington right now. Some may ask, what difference does it make who Musk is firing and what the DOGE, the Department of Government Evisceration, is doing up there to my family? Well, it makes a big difference when it comes to health care. In a Valentine's Day massacre, Trump abruptly fired 750 employees at the Centers for Disease Control. And this week he ordered that more would be fired until they downsized CDC almost half the size that it has been in the past. These aren't obscure government bureaucrats. They are epidemiologists like you. They are a team like we see behind us. They are laboratory scientists that are developing new vaccines and treatments and cures for dreaded diseases. On his second day in office, President Trump ordered a complete communications blackout, amazingly, on all federal health agencies. Suddenly, the weekly reports that came out to departments like this all across the country, reports on infectious disease outbreaks, including measles and avian flu, and various public health emergency alerts, they were all halted while a wealth of public health data just disappeared off the CDC websites. And immunization guidelines were removed. Thanks to a physician-led lawsuit, and only because of that, at least some of that information is being restored. but the new CDC communications are still infrequent and they are highly censored. About half of the budget of this department, where we are right now, about half of this budget comes in federal dollars. This is funding that Trump is illegally trying to withhold, and while congressional Republicans remain silent and compliant, the courts thankfully have issued a temporary restraining order to prevent that. I fear another deadly pandemic. Some of my colleagues who are silent seem to fear a mean tweet from Trump. They're determined to impose deep funding cuts. They're determined to reduce the CDC budget, and that will have ramifications across the country, since CDC is not just a place of excellence in Atlanta, but 80% of its budget goes out to departments like this all over the country. Losing that funding could be devastating. Additionally, this week on a party line vote, the House approved a budget resolution that, if fully implemented, would enact nearly $1 trillion in cuts to Medicaid. Again, some people say, well, I don't need Medicaid. One of every 2 babies that is born in the city of Austin out at Seton gets their health care through Medicaid. Half of the children that walk into the Dell Children's Hospital rely on Medicaid. It has an impact on all of us, and it certainly has an impact on those who need immunizations and a well child check. We know how horrific a pandemic can be. The difference between the early months of COVID, when, Mayor, I know you and your team and the judge were struggling as deaths were soaring, and we've got no help from Washington or from the state capitol. Between then and where we are today is the public health infrastructure. You have to have that in place, as well as being able to secure a 100% effective vaccine. A vaccine that is so effective that only a few years ago, in about the year 2000, measles was declared eradicated in our country. But without that infrastructure, we can't get the job done. And at every turn, the effort in Washington is to dismantle that public health infrastructure. We'll have fewer experts, fewer resources to address a natural disaster like this because of the unnatural disaster that is happening in Washington today. And it's not just measles that we have to worry about. Avian flu has already killed 1 Texan. As and this is President Trump's own CDC director during his first term, Dr. Robert Redford, recently warned, COVID-19, quote, was a minor epidemic compared to the epidemic that's coming, which is a bird flu epidemic. Hopefully it's not this avian flu, but we don't wait till the pandemic begins to do the work that these public health professionals do all the time. This doesn't have to be our reality. We need more of our citizens to be immunized. The rate among kindergartners in the Austin public schools is too low, and we need many more after they're immunized to demand that Trump and Musk not be immune from accountability. I will continue to use every opportunity I can as the ranking Democrat on the Health Subcommittee to push back on this and to work for the health of our neighbors and for our democracy. Certainly a partner in that, a partner with Mayor Watson in working on the COVID epidemic at our vaccine clinics not far from here with Judge Andy Brown, and he's going to add a few words now. Judge, thank you for your leadership.
Thanks. Well, first of all, we shouldn't be here today. As Congressman Doggett just said, this was eradicated in the year 2000, but because of disinformation, because of conspiracy theories, the rate of vaccination for measles has gone down in this city, in this country, in this county. We should not be here today. But thankfully, Austin Public Health and Travis County Health and Human Services, we've got Anna Elmahill here from Travis County Health and Human Services. We work together well. We don't believe in these conspiracy theories and this disinformation about vaccines. And so we are working together once again to make sure that we're keeping the health of this community at the forefront. Our community has proven resilient time and time again through COVID, as the congressman and the mayor and Dr. Walks discussed, and as all of y'all know very well what we went through there. We turned to churches and schools and even our rodeo grounds and the Circuit of the Americas into vaccine hubs. We don't want to get there again. We know how to combat this, and we need that vaccination rate to go up in our community. By coming together, getting vaccinated, and prioritizing public health, we can do this together. The steps are simple. Get vaccinated if you haven't already, stay informed, and look out for one another. Data from the CDC highlights just how important a high vaccination rate is. And we're not quite there in a lot of parts of Texas and parts of Travis County as well. We need to get that rate up. When a school's vaccination rate drops to 90%, the chance of a measles outbreak rises to 51%. I have a friend who just told me at lunch today that he got his 7-month-old daughter vaccinated early. Instead of waiting till 12 to 15 months of age, they consulted with their pediatrician who thought it was worth it to do that at 7 months because of this outbreak. But if everybody else had their kids vaccinated at the proper ages, this would not be an issue. So by not vaccinating your child at the proper ages of 12 to 15 months and then again at 4 to 6 years, you're putting other infant children at risk. You're putting our community's lives at risk. You're putting our economy's life at risk. The best way to keep our community safe is to ensure as many people as possible are vaccinated. I actually have another friend who was born before 1968. And Dr. Walks, I believe that if you got a vaccination before then, it might not be as effective as us who were born in the 70s and got the more effective vaccine. So my understanding that my double vaccination when I was young are good and effective because I was born in 1972. But this friend of mine was born pre-1968, and so he went and got another vaccination earlier this week in Austin. So please talk to your doctors, to your pediatricians to see if it makes sense to get a vaccination. This virus does not know any jurisdiction, city, county, state, federal. It doesn't recognize any of those boundaries. So I'm so proud to stand with our speakers today, with the mayor, with Mayor Watson, Congressman Doggett, Dr. Walks, and others who are with us in this fight previously against COVID. We're now in this fight together against measles. Please join us. Thank you.
Good job, and thank you, Judge Brown. I want to emphasize two things, and then we're going to open it up for questions. One is that vaccinations are still the best way for us to address this. And the time that we've been, as I indicated earlier, the time we've been preparing for is now here. We need to do what we need to do in order to keep this from spreading. And the second is Austin Public Health is a good resource for people to be able to get vaccinations and to get information by going to our website and utilizing that. So I also want to say thank you to all the speakers. As I indicated, collaboration is the way we can combat this and do this the way we want to do it in our community. And the good news is we have collaborative partners in this. With that being said, we'll open it up for questions, and please.
Follow from the statement. I'm wondering what our vaccination rate is, as well what steps local hospitals are taking, and whether or not we're going to advise that infants 6 months and older get vaccinated right now.
So our vaccination rate is just a little bit above 90% right now across the county. In some of our schools, it's less than 90%, which means that, as the judge pointed out, there's a 51% increased risk of an outbreak in those schools. Our hospitals are prepared. We have been in contact with our hospital partners and clinics and FQHCs across our jurisdiction, and they are ready and prepared and have processes in place to handle people who may contact them saying that they have symptoms of measles. It's important for anybody that does feel like they have measles that they call their provider first before going, so that they can make arrangements for them to be taken care of because of the contact that they may have with others in the area that are not infected and may not be vaccinated. And what was your last question?
Whether or not to move the vaccination.
So at this point, if a parent is traveling with a child to an area where there's a measles outbreak, the The CDC guidance is for a child 6 months of age to 11 months of age to have a vaccination. And then when they become 12 months, they start the regular series of the first shot and then a second shot at 4 to 6 years. When we have an outbreak declared here, then we will go into a different vaccination strategy. We do not have an outbreak at this point in Travis County, but if that were to occur, then we'd be here again talking to you about that and changing those recommendations. But right now, we're still following the routine guidance with people getting that 6-month-old to 11-month-old vaccination if they're going to a place that has a measles outbreak.
Do we know how old that baby was? The baby with measles?
I can't divulge that information right now, sorry.
Why wasn't the infant vaccinated? Was it in the grace period?
They were not vaccinated by the parent, and I don't have the information as to why not, so.
Do you know where the family traveled?
I can't divulge that as part of HIPAA.
Mayor Watson, can we talk about South by Southwest? Obviously, that could be 300,000 people here next weekend. Have you been in communication with them as far as what you would like to see done? And if so, at what point would you say, okay, we've got to make some changes here?
Well, we're not there, but part of the reason we're doing this and we're doing this now, as you know, this was scheduled before we heard of the one case, but it was so that we could get the word out and we could ask people to make sure, check their vaccinations and make sure that they have, they're vaccinated. We're encouraging people to do that. We're doing that in part because South by is coming and we want to take those kinds of precautions. Dr. Walks and her team have been in direct contact with South by, and I'll let her address anything she wants to add to that.
We work in collaboration with Austin Special Events to help them mitigate and strategize for health precautions for events, and our team's been in contact with them and with our business partners across the city.
Are there any protocols that you can talk about that are we at the point of encouraging them to make any sorts of changes? You know, social distancing is a 2020 phrase that we remember hearing. Are we at anywhere near that point at all?
No, we're not. We do not have an outbreak at this point. We are at the point where we're trying to get people prepared and vaccinated. Yeah.
Mayor Watson, you're a former state lawmaker. The state legislature has some 20-odd bills that have been filed to loosen vaccination requirements and other things to deal with this sort of thing. Do you have any message to those lawmakers as they get into the session and have those bills before them?
Well, it's unfortunate that you have bills like that, and it's unfortunate that we're not focusing on what we know to be the science and the statistics that come with the science. I mean, you've heard some of them. By the year 2000, it was considered this disease was considered to be eradicated because our vaccination rates were so high. That has declined over time, and what you see is, I guess I won't call it a natural result. As has been pointed out, rhetoric that speaks out against the science can lead to death. And so part of the reason we are here is to speak specifically to those things, not play politics, but instead focus on what we need to do to keep people healthy and keep people alive.
Couple more questions. Andy Brown, can you say what you said briefly, but in Espanol for us, please? Or like a few words, like a sentence?
Sí, okay. I'll try. Okay. Bueno, el problema con sarampión ahora es... ¿Cómo? Sarampión. Okay, el problema con sarampión ahora es que personas que tienen niños que no le dan vacunas da más riesgo a todo el mundo de niños de padres que sí quieren darles vacunas, pero no pueden porque son muy jóvenes. Entonces es muy importante que todos los padres ahí dan vacunas a sus niños en la edad en que el médico les dicen que lo necesitan, porque si no, pone en riesgo a todos los niños en nuestra comunidad. Did that get it more or less?
Yeah, can I ask just one question to Flor?
Yeah, sure.
So tengo una pregunta. Mucha gente inmigrante no sabe si tiene ya esta vacuna en su país. ¿Les afecta si vuelven a tener esta vacuna aquí en Estados Unidos? ¿O qué recomiendan?
Bueno, ellos si no saben su estado de vacunas, ¿verdad? Ellos pueden tener dos opciones. Una es hacerse una prueba para ver si ya tienen los anticuerpos para esa enfermedad y la otra pueden recibir la vacuna, un refuerzo de la vacuna. Normalmente en países de Latinoamérica reciben las vacunas, están bien al día con las vacunas, ¿verdad? Y ya tienen dos vacunas, dos dosis, ¿verdad? Casi todas las personas que vienen. Pero si tienen dudas o nacieron antes de 1968, entre el 63 y el 68, pueden recibir un refuerzo.
Just to clarify, do you believe that this case has any connection to the Hayes County exposure?
No, we do not.
Thank you all very much. We really appreciate your being here and helping get the word out. If things develop, we will be back here, and we're going to work very hard to communicate with the community about what needs to be done. But the number one thing that we're talking about right now is please check on your vaccination records and do what you can to become vaccinated. With that, I want to say thank you to Austin Public Health. They always, I got to tell you, as mayor of this city, they always make me proud. And so I'm very pleased to get to be with them. And I want to say thank you to Dr. Walks for the role that she plays, and Flora, and I want to say thank you to our county judge for even when he makes cracks about age. And I want to say thank you to Congressman Doggett for the emphatic role that he plays in our community. Thank you all very much.
Thank you.